Sports Live with another Doc Talk segment brought to you by the Bone and Joint Institute, boneandjointtn.org. Austin Stanley, Zach Bingham, joined by Dr. Scott Arthur, fresh out of an ACL surgery to sit down and talk with us about the bone bruise in A.J. Brown's left knee. What is a bone bruise? We're going to go through all of this with an expert, Dr. Scott Arthur, who did a great job on my knee 11 years ago, Dr. Arthur. So time is flying with that. But thanks to have you along. Appreciate you sitting down with us. Bone and Joint Institute right there in Franklin, a beautiful building. They do everything from the start to the finish of your injury and recovery process. So check them out at boneandjointtn.org. So Dr. Arthur, we'll just start with as simple as it gets. What is a bone bruise in the knee? If you could explain that to us, please.
Sure. Yeah, guys, thanks for having me. Yeah, an interesting topic. Bone bruises are, fairly common. And what it is structurally, if you look at the knee, and if you think of the knee like a honeycomb as far as the architecture of the smaller structure of the knee, a bone bruise is basically a little crack in the honeycomb. So it's not a major break where it goes all the way through the bone or major disruption, but more of a small micro crack through that structure of the bone. And then you'll have bleeding and swelling into that. And that's what you typically will see on an MRI is the sequela of having the crack, which shows inflammation and swelling in the bone.
Yeah, we're trying to figure out what A.J. Brown is feeling. He's obviously a key component to the Titans offense. When you talk about a bone bruise in the knee, when does it hurt? Does it hurt when you run, when you walk? Does it ache? What is the feeling that maybe A.J. Brown could be experiencing with this injury?
And bone bruises are probably one of the most variable things we see. And it can be minimally symptomatic all the way to difficulty with any weight bearing and sort of pain at rest. I mean, typically it is more pain with direct pressure on the bruise. So it's not asimilar to a bruise on the muscle where if you press on it, it hurts. With the bone bruise in the knee, the pressure is going to be weight bearing, running, jumping, cutting, that sort of thing. And a little bit of location of the bruise determines what seems to hurt. So if it's more in the back of the knee, it hurts more with the knee flexed. If it's more in the front of the knee, it's more with the knee extended. So it can be pretty variable as far as what causes symptoms. But typically pressure phenomenon, as your body's trying to heal that little micro crack and you put pressure on it, it hurts.
Dr. Arthur here with us on Doc Talk, Bone and Joint Institute, boneandjointtn.org. The report that came out from Adam Schefter yesterday that kind of led us to this point is that A.J. Brown missed practice yesterday. His availability has been jeopardized, Adam Schefter's word, with this bone bruise in his left knee while playing a wide receiver position and playing it as physical as A.J. Brown does. What do you think how would this type of injury limit him in playing, or is it just more of a pain management situation that he's going to have to be dealing with?
I mean, it's a little bit of both. I mean, obviously it's early in the season, so you want to try to keep from having things turn into more chronic and ongoing. So it's a balance between comfort and performance. So typically the way we manage these is, start basic and, if it hurts to walk and can't hardly run, then we stop there. If you're able to run comfortably, cut, sprint, do drills, work back into playing. And so it really is a comfort type decision and a performance type decision. And it does vary time of the year. If it's a playoff run, you're going to be a little more aggressive than you are first time of the year or first couple of weeks of the season where you're, hey, let's get this thing well so it's not nagging him further into the year. Because you do have to, when you think about a bone bruise, it needs to heal. And the best way we know to gauge healing is symptoms. So if things are doing pretty well, a little sore after the game, you're not too worried. If he's having pretty significant pain with activity, you'll worry that you're ultimately slowing down the healing process and maybe dragging this out for 3 or 4 weeks instead of where they're taking a week off and getting well.
Dr. Scott Arthur on Doc Talk with us, brought to you by the Bone and Joint Institute. Both Austin and I have used the Bone and Joint Institute, and we endorse them because they offer so many different things here in Middle Tennessee. Let's talk about best and worst case scenario. as far as the healing process, how many weeks out, if you just shut it down, not going to do anything, let it heal to get back to 100%, would you, kind of gauge on that length of time? And then maybe the worst case scenario, can a bone bruise turn into a fracture if it's hit the wrong way? Obviously, football, anything can come at you, but kind of weigh those two scenarios for us.
Sure. And, when I sit in the office and look at a patient with a bone bruise, it is one of the things that I have the least predictability on telling the patient how long is it going to be till I can play football. It just seems to be the MRI correlation gives us some information. So size of the lesion, location of the lesion, mechanism of injury gives us something, but it's still extremely unpredictable. And it can vary all the way from you get an MRI and they're like, just, hey, I'm worried about them, having an injury, their meniscus, and then time to get the MRI, they come in and they're pain-free, and you see a bone bruise and like, well, I'm fine, it doesn't hurt me. All the way to having people that have nagging pain for several months. So it's a hard one to predict. And you're really kind of stuck with gauging symptoms and progression as far as, day by day. Typically, you're hoping something that's a isolated bone bruise that, a few weeks, whether that's a week or 2 or 3, to let things cool down. And some of it does depend on, how aggressive you are and if you're rested. If you're rested, it tends to heal more quickly. Whereas you put a lot of stress on it, may drag it out a little longer. So it is a hard one to answer as far as time to return. As far as fractures, that type of issues, typically not at all a worry that you're going to go out and that next thing you know he has a femur fracture. Not really worried about that standpoint. And we see bone bruises almost always with a torn ACL. So if you tear an ACL, you have a shift of your knee and the two bones impact each other. And so almost everyone that has an acute ACL tear will see bone bruises on the MRI. And we think there probably is some relationship to the severity of the bone bruise and potential for cartilage injury and arthritis down the road. Typically not a short-term or even a mid-range term problem, but down the road can some of these lead to potential arthritic type issues? Probably. More so in a multi-injury like an ACL probably than a isolated bone bruise. And when we're talking about a more like A.J. Brown's, you can have that happen with a direct blow with a helmet to the knee, or you can have a sprain where you hyperextend your knee and the two bones bump against each other. So kind of the mechanisms that can happen.
Yeah, I want to have a follow-up on that. Is it more at risk if with a bone bruise to tear an ACL, MCL, or can you gauge that?
No, any injury, as far as your knee being weakened and more at risk, no. If you're biomechanically not 100%, you're always a little more risk for injury. So if you're, sort of favoring that side and afraid about, not wanting to push off and cut on that knee, just subconsciously trying to protect it, you can change your mechanics and then put your body at more risk for either an injury to that knee or the other knee. So not a structural weakness, but it's part of what we like to do before we get athletes back on the field is make sure they're able to be mechanically sound to be able to protect from additional injuries, not necessarily from a bone bruise, putting them at weakness from the structure of the knee.
A to Z Sports Doc Talk. I got Dr. Scott Arthur here on the line with this Bone and Joint Institute, boneandjointtn.org, talking about A.J. Brown's bone bruise in his left knee. Adam Schefter reported yesterday his availability could be jeopardized against the Jags. So I know you're not dealing exactly with A.J. Brown, but does it mean anything that he just played in a game with a knee injury that's been happening for several weeks? He just played Monday. Does that mean anything to you about maybe it got worse Monday? Because we know for a fact, our information, that this did not happen Monday night. It was already existing. So does that mean anything to you that he played through a game Monday and that now maybe it's re-aggravated for this following week's game?
Yeah, it certainly could have had an event where he tweaked it a little bit again and put a little pressure on it. Could just be the stress of a full speed game was a little more aggravated than expected, or just still this week having a little more symptoms and making that judgment call that, look, we'd rather get this thing 100% and have a long season on week 2 than continue week to week to be missing practice and missing time and dragging this thing out a little bit longer. So not necessarily any damage that was done, just more of a decision based off of symptoms and how it's progressing. And it may be that just a little more symptomatic after the game and trying to make a decision long-term, what's best for his knee.
Yeah, that's very interesting. I think we're all curious to see whether it affects A.J. Brown this coming week. And you talk about we've talked about obviously short-term effects, the long-term effects. You talked about the honeycomb on the structure of it. I'm kind of interested in this. Is there bleeding within that, and it heals? And the other thing is the healing process. And this, I don't know if this is a good or bad question, but would cryotherapy or anything like that, can you expedite the healing process with something like this?
We haven't figured out anything that's consistently beneficial to help enhance healing. As far as external means like a cryotherapy, probably not going to help. If you had a more extensive problem, people talk about injecting stem cells or different things that way. That's fairly invasive because you have to drill a hole into the bone and then inject material. There are instances where that's appropriate. That would be aggressive and probably go backwards and take a whole lot longer to recover from having a hole drilled in the bone than simply allowing recovery. So limited as far as the other modalities that are going to enhance healing. Back to the honeycomb part, that's the best analogy I think we have for what the bone looks like on the inside. It's not solid, but it's not hollow. So it has sort of these walls and lining of the honeycomb that you get a crack, and then that bleeds, swells, inflames, and that's what causes pain, and that's what your body ultimately goes in and absorbs, heals the break, heals the crack in that little honeycomb. So not a true break fracture as we think, but just more in the microscopic structure damage to the bone.
Yeah, I got a question from Jimmy on Facebook. He asked if AJ gets hit on that specific knee, could that crack get even worse? And I know we've talked about could it tear a ligament, and you said not necessarily, but could that bruise continually to get worse and that crack maybe get even bigger?
Unlikely. Most of these tend to be more kind of a hyperextension sprain where you get a bone bruise where you now occasionally it will be a helmet to the knee, and that's what caused the bone bruise. And then if you had to take a helmet to the same spot, yes, you could still continue to aggravate or even extend a little bit of the nature of that honeycomb crack. So it does vary a little bit based off how you did it. We don't tend to worry so much about everything. If he's doing great, is he going to hurt it again? It's more kind of current symptoms that you worry about.
Right. Dr. Arthur, appreciate the time. Very informative. I had no idea that I probably had a bone bruise when I tore my ACL 11 years ago, but you did a good job on it. So I always thank you for that, and always like the relationship. And thanks for the information. Good stuff here today. Dr. Arthur of the Bone and Joint Institute here on Doc Talk, talking some. Hopefully we all walk away from this knowing a little bit more. I don't know how you guys Titans fans feel about A.J. Brown on Sunday, but thanks for the info, Doc, and we'll talk to you later.
Great, guys. Thanks. Enjoyed it.
Thank you.